Welcome to the sorry, I'll start again. Welcome to the Health Coach Show. In today's episode, we're talking to Dr. Shami. Dr. Shami is, sorry, and I said Shami. My God, what's wrong with me? I'm going to start again. Welcome to the Health Coach Show. In today's episode, we're talking to Dr. Shami, who is an integrative GP who's the director and co-founder of the Mint Clinic here in Melbourne. So, Dr. Shami, tell us all about health coaching and how it's changed your practice.
Wow, where do I begin? That's a not great question to start off with. So, literally, when I reflect back, I've been in GP for 23 years, and then I just lost faith in the system about 12 years ago. And I was thinking, this has got to be better. Literally, it has to change. Because when I graduated as a GP, this was back in the UK, I was working as a GP, and then I actually got so disillusioned. I took a year off, went traveling, and came back to it, and then moved to Australia. And it was slightly better because you had, more time with the patients. There was a better remuneration, better work-life balance. But I was still thinking this is going to lead to burnout just because of the system, the way it's all constructed. And when I really pinpoint it down to where the doctor is supposedly meant to fix it all, and the patient takes zero responsibility. So we were in 10-minute consults, and I'd often get patients, right, I want to lose weight, tell me how to lose weight in this 10 minutes, and it has to work. And they'll come back and go, it hasn't worked. You haven't solved it. And so when you really step back and you look at all our consults, how much stress does that create in the doctor to go, right, I need to figure out all these problems, all these solutions I need to come up with, may have 30 patients a day during those times. It's a lot of pressure on the doctor, and no wonder doctors get burnout because the system doesn't make sense where the patient doesn't take any responsibility. And it's not a quick fix. Like, medicine and wellness is not a quick fix. It's actually a lot of habit changing that you have to do. Only you know how you can change your sleep routine. Only you know what to do about that. Only you know what food choices you can make when you're busy on the run. And that's not something a doctor can tell you. So what I've noticed in the system, we've created co-dependency, where we've relied on the doctor to find all the solutions, where the patient takes zero responsibility. And it's this back and forth, whether it's over weeks, over months, over years of trying to find a solution. And it comes down to, the quick fixes of medication. But hold on a sec, chronic disease, 80% is lifestyle and diet when you really look at it. And there's always a place for medication, especially when you think about acute setting. But when you move over onto chronic disease, there's a lot you can do from lifestyle and nutrition where you can get amazing results and patients actually can feel better. So that's when I shifted into integrative medicine 10 years ago, more of a personal journey through health reasons where I was not getting the results I was looking for. So I started with ACNEM, Australian College of Nutrition Environmental Medicine, and I thought, wow, how did we miss this in med school? I felt like I was relearning wellness, relearning medicine. And I was seeing a phenomenal change in my patients. I was empowering them to actually start looking after themselves. You can do this. Like, the human body is designed to be well. You can do this. But you need to take responsibility for that. So whether it's education, awareness, you're changing the habits. So I, funnily enough, stumbled upon it, whether it's via books or just my own experience, that I realized patients love being empowered. They feel amazing when they do all the strategies and they walk away feeling better. And that was always been my ethos. So, but I always thought, I could do this better. I need to learn to consult differently. I knew about health coaching, and then I stumbled upon your course, Sharon, and I go, this is perfect. 6 weeks, that's what I can do. It's all about practical skills. So it's the 4 hours every week. That's what we needed. We needed practice. We needed a direction. And what I felt on your course was, it was just very practical, just methodical, and it's something that I could implement instantly in my consults. And despite being, 23 years into it, I learned so much and I felt it was life changing. And I think every doctor needs to do it. I think this is the missing link that would prevent burnout. So, yeah, absolutely life changing. And so, I don't know if you want to go into, what are the areas of health coaching that I use in clinic every day. It's just transforms my consult to the point where I'm not creating all the solutions. The patient is coming up with the solutions when it comes to lifestyle and the shifts in the diet that they need to make. And so I'm relaxed, I'm having fun, I'm enjoying it. Patients leave so empowered because they go, oh, wow, actually, I came up with that solution. That means it means something to them. That means they're more likely going to do it. And also, it always amazes me when I started the change in the language, when I go, okay, what do you want to do about sleep? And they'll come up with all these amazing ideas. I go, wow, I would have never thought of that because I don't know what's happening in your life. So I would not have thought that you're actually doing all of these things that is affecting your sleep. And we don't have time in the day to figure all of that out. Only you can do it. So it's life changing. Haven't looked back. And I think everyone needs to do it.
Yeah. I think the journey that you've talked about, I think a lot of people would feel the same. We see those passive, disempowered patients who are looking to the expert GP or dietitian or nutritionist to fix me, to solve this. I'm disempowered. I don't have it within me. And then you've come on this journey where you've realized there's more, not only from a holistic point of view of looking after your patients using that more integrative approach, but you've also learned that this approach of health coaching, that even when you came to our course you had really got a good understanding of what you needed to be. Like, it was apparent that you'd already done some research and done your own self-development in it, and you really brought that approach of wanting to know, how do I do the best thing for my clients? It's not just for you and your burnout and preventing the burnout that so many health practitioners talk about, but actually, how do I do the best thing by my clients? And you've just described they love it. They come up with the ideas. They're committed to their own ideas. It has fun. There's a fun element to it. It has meaning for them. And you really bring in that sense of, where are you ready to start? What ideas do you have? And you really treat them like they are the expert in their life.
Absolutely. And I think we forget that. I think we forget, unfortunately, it still happens till this day where, unfortunately, doctors have this hierarchy and authority and they think they know best. And I'm going to put it out there that you don't know best for that patient because you don't have never lived in their experience of their own life. And it's really important to respect that. And it's a joint decision here. It's a collaboration of how do we get you better rather than I know what's best. And I think that's really important. We move away from that and go to more collaboration. I think on your course, I do remember you were saying, at the end of the day, it's just being curious about the patient and their life and questioning. And I'm always curious about their life. I just find it really interesting and fascinating. And often patients love talking about it. So it's not hard to gain more information. But what I learned from the course was just key questions to use. What I noticed, what I was using before was I was using we, I never used you. And it's that simple change of what do you want to do? Because I realized, wow, I was taking the responsibility when I need to give the responsibility back to the patient. So simple change of what do you want to do next? How is it going to affect you? What are your strategies? And even writing things down. How about you write that down instead of the doctor writing it down? It's so interesting how we've just created that habit and just shifted to empowerment. And so you was a big thing for me. And those two lovely questions, which I tell a lot of people about, confidence and importance, and just that scoring around it. So often I finish, how important is this for you now? But I use how confident are you on a scale of 1 to 10 quite often, because they leave with a few strategies that they need to implement. And I love that because I know the scoring, if you score lower in simple terms, that's all their motivators. And you go, why haven't you scored higher? That's their barriers. And it gives you a quick snapshot of where they are. I think that's just awesome. So I use that a lot. And of course, I can definitely improve on reflection and summary and all of that. But I've just taken great snippets from your course, and it's transformed the whole consult, really. Patients just leave feeling empowered and happy.
Yeah. And what's been the impact on you personally? You said you don't feel like you need to be the person fixing everything, solving anything. Is there anything else?
Oh, that's huge, actually, because you walk into clinic going, great, really looking forward to seeing my patients. Can't wait to hear their stories. What have they done? And even if they go, right, this hasn't worked, I don't take that as a responsibility for me. I go, right, okay, what else is happening in your life? And more often than not, they may have missed a few strategies. It's their responsibility. And, we go deeper. So I take the pressure off myself. So work is just really enjoyable. It's not really work, it's just, enjoyment of going in and seeing patients transform. So that transformation is quite remarkable.
And what do you notice about the connection? Do you feel there's a difference when you use the health coaching approach when you think back to how you used to connect with clients?
The connection, I think patients really enjoy problem solving themselves. And as a result, it's much more of a collaboration. So at Mint Clinic, we actually have big round tables. We don't have the desk and the big screens. We've got big round tables and laptops. So when I go through results with them, I'm sitting next to the patient and we go through it together. And the patient writes things down, takes notes. I give lots and lots of different ways of educating patients as well. So it's very collaborative and they enjoy it. I enjoy it because the pressure is off both of us because at the end of the day, we come together to find a solution.
Yeah. And because you're curious and you're listening, that helps them think, oh, wow, this doctor's got faith in me. They think I've got this. And they feel more courageous as well as more confident.
Absolutely, absolutely. So it's really interesting because I've moved away from that old model fully now. And before I could see it, it was a stark difference of the quick fix model, patients not feeling empowered, to patients already doing research, learnt so much about the health condition, taking steps already, wanting more and wanting more guidance. And it's two different personalities, and so two different sort of environments to work in. And now I've actually forgotten about that old model. I didn't realize that I was battling with patients to get them well. Here, I'm not battling. They want it, they're ready, they're motivated. So it's so interesting when you look at the two different environments and I go, wow, I used to work in that environment. Because, to actually go, oh, can you write down what you ate in the last week? And I remember that was tough to get even a food diary or even that, oh, just few lifestyle shifts was tough. If you just tell patients what to do, when they come up with the solutions, that's when you see transformation.
Yeah. And I think, you're talking about that sort of old model where we assume they haven't done any research. We assume they have no knowledge. So it could have been even, in the way you're practicing before, that people might have come to you and they might have read things, they might have done research and they had this pool of ideas. But when we operate from that expert model and we just start telling them what to do, we don't even give them the chance
Spot
to
on.
to us or to ask us questions or to
Exactly.
explore that with them.
Exactly. I wonder if it's, in our mind, we're thinking we're time conscious, but like what you said, it actually saves time. So we're going, right, we sort of like vomit out all this knowledge, quick, let's get it done. When actual fact, the other model actually takes less time. But we're so worried that it's going to take more time that we don't even bother trying.
Oh, that's so true. And we get that a lot. We have people who say to us, "Oh, I'd love to learn health coaching, but I just don't have time." And I'm sure that if you compare the effectiveness of vomiting information at them,
Yeah.
um, compared asking them a few questions,
Yeah.
yes, you might feel one's more efficient because you get your agenda met, but actually does the client get their agenda met? Do they
Spot on.
actually do anything? Nope. So which one really is more effective and efficient?
Yeah, you're absolutely right. You've made a really good point. Whose agenda are we meeting in that scenario? Absolutely.
So if you, what was there anything surprising about health coaching when you studied health coaching? Was there anything that really surprised you that came out of it?
I realized it's not as hard as you think. And because you've simplified it, and it's all about practice. It literally is all about practice. And it's the way we communicate. So the way doctors are trained to communicate is quite different. So when you think about it, we should be trained in the health coaching model right from the start. And that will take a lot of, time unlearning and relearning a different model and having faith in that process that it actually works. But there's a lot of things to consider. For example, the hierarchy model, the expert model. I know what's best. They need to listen to me. You've got to move away from that. It's, have faith that the patient actually knows a lot more about their body than you do.
Yeah. And so with your new model that you now practice, what sort of results do you see in your clients?
So I think the most important thing is patients need to invest time and money into this strategy. When you invest that, that means you take it, you make it a priority. If you don't invest time and money, you don't value it. And it's as simple as, for example, you buy an expensive car, you will take care of that car. You will park it in the right place. You will watch out for any little scratch, you take such good care of it. So with this model, it's really important. We're talking about lifestyle change. So you've got to be ready for it. It's a priority. You're responsible. There's a couple of things of mindset that you have to sort of have a look at. And when you invest that, you do the work, it becomes a priority. And as a result, when it becomes a priority and you do the work, you see the change and you get better. And it could be something simple as that your sleep's improved. That means your energy's improved. That means you're less anxious in the day, and it's a domino effect. But that motivation needs to start with that shift in mindset. So it's now a no-brainer creating this model, because when you're already invested, health is a priority, and you're responsible. That means you need to do the work, and you've got a collaborative approach, and you've come up with the solutions. The guide is the doctor, and you actually see the results. It's a positive feedback loop. So you keep going.
Yeah, you're right. And we all know everyone wants results. Sometimes they think they can get there by a quick fix. But when you use your skills to connect the dots between the better health that they want, and who doesn't want to feel better, who doesn't want to, have less aches and less pains and to sort out their gut. Essentially, they come to doctors because they want something to change. And then when you're using that health coaching approach and you've got that really well set up model to support them, like you said, they are invested. They're invested in themselves. They're not invested in getting results for you. They are invested in, I want this better life. I want these things. I'm willing to put the work in because I'm not being told what to do. I'm choosing what to do. And they can really, because you're co-creating with them, even though, of course, you're an expert. You will say these are what your results mean, or
Yeah.
this is the way forward that might work for you. And then, but they still get to choose, right? They still get to decide their priorities. They get to decide where they're ready to start. And the whole time they've got you and your team supporting them.
Yeah, absolutely. Absolutely. And it's just so much more rewarding, so much more joyful.
Yeah.
And so, yeah, it becomes really, really enjoyable.
And for the, it's enjoyable for you, but what about your clients?
Yeah.
How amazing is it for them to be heard, to be treated as equals, to get results? It must be amazing.
Absolutely. Absolutely.
Yes. Well, we're so happy that you studied health coaching with us. You were certainly already all along your journey in terms of changing your approach. And I think that you have embraced it and run with it. And I know that your success is no doubt due to the way that you just, listen to your clients and really support them through that journey of change.
Amazing. Thank you so much, Sharon.
Yeah, thanks for talking to me today. And if you want to follow Dr. Shami, you can, and through Mint Clinic, and she's got her own podcast called The Six Hats, which is a fabulous podcast all about lots of different health topics and all about the many hats that we juggle. So tune into her podcast and follow her amazing work.
Amazing. Thank you, Sharon.